Hello, my name is Dr. Fabi, and today I have a beautiful patient of mine who's also a physician. She's going to be 48 this year. I've been treating her for 5 years, and today what I want to talk about is the importance of maintenance treatments, because she looks younger, even more beautiful today, even with 2 kids, a full-time job, like many of my professional women patients. And the reason she looks so amazing is because she's done a little bit to every single layer of her aging face. And so originally our patient came in complaining of under eye hollows. And although that was a real concern, the reason we start to develop under eye hollows is because we start to lose the bone underneath that hollow. So that with time, if you don't address that volume, this fat pad starts to split from that underlying skin. And so really, it's not just filling in a line or a hollow, because that's not how we're losing volume. We're losing volume because the maxilla, the bone right in the middle of the face, is actually inwardly rotating with age, and then this bone is also flattening with age so that you lose the support where your fat pads sit. So they split from the fat right underneath the eye, and you develop an infraorbital groove or hollow. And many patients end up getting filled just because it seems so simple to directly fill that line, and in fact it ends up looking unnatural and can even leave you with little blue lumps underneath your eyes. So it's really important to address the underlying issues so you can get a more comprehensive result. But in addition to a little bit of filler, which we've been using Sculptra on our patient, which stimulates her own collagen to form, we've also done a little bit of Dysport over the years to relax the muscle, as well as IPLs combined with Clear and Brilliant to stimulate new collagen at the level of the skin. So that if you come and you take a look at our patient at the age of 43 and now almost at 48, 5 years later, she looks softer, especially around her temples, than she did then. She looks more symmetric because we've placed filler equally and evenly, addressing her asymmetries along the bone. And she also has a little bit more volume with the use of Bobella to her lips. Sculptra has been used along her jaw, her cheekbones and temples, and Dysport has been used to soften up the lines, as well as IPL combined with Clear and Brilliant to address the skin. So it's really like anything that we do. We get a 6-pack, you just don't get the 6-pack and stop working out. You have to maintain it. You don't have to put in as much as you did to originally get it, but you have to do little things here and there every 3 to 6 months to just maintain what can eventually be a very nice natural result. So for more information, visit us at clderm.com.